Well, thank you all so much for joining us. My name is Marcus Anscombe. I'm the Interim Director of Admissions here at Bastyr, and I'm joined by our Dean of the School of Naturopathic Medicine, Dr. Christina Connor. And our enrollment team is here as well, so you'll see them floating around the questions box as we go out throughout the session today. If you have any questions, you'll see that questions box on your Zoom panel, so feel free to ask those questions at any point. We'll probably hold questions until the end, but if you have questions as we go throughout and you want to make sure we answer them, make sure you enter them in that box, and we're happy to get to them. So we're going to give you a little information from Dr. Connor about the program itself, and then I'll come back in and share a little bit more information about admissions and financial aid later on. So without any further ado, I'm going to pass it over to Dr. Connor, and thank you all so much for joining us.
Yeah, thank you, Marcus, and thanks everyone for joining today. I'm really happy to share with you a little bit about the program here at Bastyr and just about naturopathic medicine in general for those of you who are new to us. So we'll start off just by talking a little bit about naturopathic medicine and our basic principles and kind of fundamentals. Next slide, please. So a quote here, and this is from our National Association of Naturopathic Physicians. Naturopathic physicians seek to restore and maintain optimum health, and the method by which we do this is by enhancing and reducing the inhibition to be able to heal yourself. And we call this process the vis medicatrix naturae. That's a really important principle in naturopathic medicine, and it's probably the most unique feature to the profession and to the approach to patient care. We believe as naturopathic physicians that our main role as a doctor is not necessarily to be active, but to remove the things that are allowing someone to heal themselves and to facilitate the working of the V's. So that is one really important thing that we do that is different. And I'll talk a little bit about similarities as we go through today as well. So our naturopathic principles, that first one is the vis medicatrix naturae. And then we have 5 other principles that are familiar and may share kind of pieces with other types of medicine and other approaches to health. So one is tolle causam, which is treat the cause. So you'll hear this a lot of times is treating the root causes of medicine of disease and disorders. What we aim to do is really try to get at the real reasons behind why someone may be experiencing ill health. And like I said, remove those obstacles and facilitate using different modalities to allow them to regain their health. The next one is primum non nocere, which is first do no harm. Now, this is a pretty common tenet throughout all types of medicine, and it is certainly one that we hold as very highly important to our approach as well. So we will try to use the least invasive form of intervention as possible when we're both diagnosing and treating patients. Docere is a really important one as well. This is doctor is teacher. And docere, what that means is you, as a naturopathic physician, you will find that you do a lot of teaching of your patients. And I mean both in formal settings, but also informally with every single patient. We are very adept at being able to walk people through what's going on with them, why it may be going on with them, and also help them understand if they've been diagnosed in a more conventional setting, how that impacts their overall health. We also do a lot of teaching about lifestyle that is really fundamental to naturopathic medicine. And there's Tolle Totem, which is treat the whole person. Again, this is shared amongst many other forms of medicine as well. Our approach is a little bit unique compared to other forms, but we also aim to treat the entire person, the mind, body, spirit, as well as so physical health as well as mental and emotional health and spiritual health. And then the last one is prevention, preventare. And prevention, of course, is fundamental to most forms of medicine. Everyone tries to prevent diseases before they start. Again, we have kind of a unique approach in this area, but that is something that we share with other forms of medicine. So the Vis Medicatrix Nurture, I talked a little bit about this already, but it is our role to support and facilitate and augment the process that allows someone to return to health. What we do is we talk a lot about the determinants of health, which is something you may have heard in other contexts. The determinants of health means that these are things that we focus on regardless of the person's disease or condition. We will always look at, for instance, the water that they drink, the air that they breathe, their sleep and their movement patterns, and their food. These are all very essential determinants of health, and we try to create as healthy as environment as possible, which can remove a lot of those obstacles to cure. So the way in which we do this, so the principles are kind of the foundation of naturopathic medicine and the naturopathic approach. The way in which we actually operate as a naturopathic physician is based on what we call the therapeutic order. And what this means is it is a guidance for us in how we approach a patient's diagnosis and conditions. So we start with the bottom of the pyramid here, establishing the foundation for optimal health. And then we move up the pyramid as we need to. You may be, as a naturopathic physician, kind of treating patients and helping patients in multiple areas. It doesn't mean that you only use high force interventions when everything else has failed. But what it does mean is that there's kind of an order in which we look at this and in which we analyze cases, and we really try to make sure that we're only using those higher force interventions going to the top of the pyramid um, when things have been exhausted or when the pathology really calls for something that needs a higher force intervention. Naturopathic doctors are fully supportive of surgery and medications when needed. We just want to make sure that there's places where people can go to if if they don't need those things yet or if they want to do things in addition. So that's the lower part of the pyramid there are the areas that we work in either in addition to or instead of um, as appropriate to the patient's condition. So the least force necessary is really what we try to do. And modalities are, again, it's kind of a method. So the therapeutic order kind of guides us in how we look at cases and analyze cases and then choose modalities. And then the modalities themselves are often a combination for each patient. In fact, you will find for most naturopathic doctors it, that we treat patients in different ways. And so the treatment plan for a patient might be very different from doctor to doctor. Also, a treatment plan might be very different even if someone has the same condition. We don't do the things necessarily the same every single time. We really try to individualize treatment, and a lot of this comes out in the types of modalities that we use with patients. Many of these are also somewhat patient driven. So we work very closely with patients to try to optimize their care. And a lot of times, what that entails means we try to choose things that they're going to be able to do and things that they are interested in working with. So, if a patient, for instance, is very interested in working with hydrotherapy or physical medicine, um, if a naturopathic doctor finds that that is appropriate for them, that will often be a big focus of their care. But there may be some patients who say, "Oh, I don't want to try, a certain type of modality," and that's okay. One of the things that's really, really fortunate about being a naturopathic physician is you have a very wide toolbox. So even though, many practitioners will use other types of interventions like these, we learn all of these to some level of depth. So we're able as naturopathic physicians to kind of mix and match these things as appropriate and make sure that it's really the right mix of treatments for each individual patient. And I'll mention here too, so this was on the previous slide, but you'll also see some slight differences um, or sometimes large differences between what modalities we can do legally. Um, I'll stress that even if you decide to go back to a state that is not licensed yet for naturopathic medicine, you will still learn all of these things within the curriculum at Bastyr, because we prepare students to be able to go into really any setting and any state or jurisdiction, and be able to practice naturopathic medicine effectively. So on the next page here is the map of the states where we're licensed or regulated. And right now there's 23 states and DC, Puerto Rico, and the Virgin Islands, as well as a number of provinces in Canada. NDs graduate, and what our program is it's called an accredited medical program, and it's residential, meaning even though we do, it is primarily in person. You need to be here to be able to attend the program. Um, that will qualify you once you graduate from our program, as well as any other accredited program, to be able to take our licensing exams, which are called NPLEX exams. NPLEX exams will allow you to, along with a few other things, depending on the state, will allow you to be able to be licensed or regulated within a jurisdiction. So for instance, once you take NPLEX, you can be licensed in Washington or Oregon or Utah, as long as you meet the other qualifications for that state. But the licensing exams are really a big part of showing that you're a safe practitioner. And so that's what allows you to be able to obtain a license. Um, on this map, you'll also see all of the states that have active licensure efforts right now. So there's a number of states, particularly in the Midwest, and a few states in the southeast of the U.S. That are very active in trying to pass legislation to regulate or license us. So that is growing over time. And you can find out more information if you go to the American Association of Naturopathic Physicians website. It has a lot about our active licensure efforts on that page. So I'll talk a little bit about our scope of practice in both Washington and California. Many of our students come from all over the country, and sometimes other countries. But a lot of our students do choose to are either from Washington or California or choose to stay in the area once they graduate. So we do gear the program to make sure that we meet the requirements in both of those states, although you can still pretty easily practice in other states as well and be licensed in those areas. But this is the scope of practice in Washington. It covers both lifestyle, medications, physical medicine, botanical medicine, counseling, as well as some minor office procedures and the ability to do IVs and vaccinations, and some other types of office procedure injection type therapies. Um, our prescriptive authority within Washington is currently we can prescribe most medications with the exception of some uh, um, uh, regulated like opioid type medications that we cannot currently prescribe. And then next in California, uh, NDs can provide primary care services in California. However, we are restricted from using the term physician in California. Um, there are a few things, it's similar to the Washington state scope of practice in that you can still do physical exams, you can administer lifestyle recommendations, botanical medicines, and some types of physical medicine. However, we can't do all the office procedures that are available in Washington, and all prescriptions are non-controlled substances. Also within the physical medicine realm, there are some restrictions. We cannot do what is really like a high force manipulation of a joint. However, we can do most other types of physical medicine besides that. So next, let's talk a little bit about our program here at Bastyr. So here's our mission and vision. Um, Bastyr has had a long history ever since our founding of being a leader in mixing both tradition and science. And that is true really of all of our programs. It is especially true for the naturopathic medicine program, which was the first program at Bastyr. Um, we understand that there is a role of tradition and we want to be as evidence-based as possible at the same time. So we have a strong emphasis on being research literate, engaging in research if that's an interest of yours, being a leader in the profession, and really being adept at bringing together both traditional knowledge about many of our therapies and our medicine with the world's and the conventional and more modern scientific techniques, everything from laboratory tests that we use for diagnosis to types of treatment. So we mix all of those things and we have a very strong emphasis on the importance of both the nature and the spirit of the medicine and the tradition, as well as the more contemporary types of medicine. So there are a few things that make us unique. As I mentioned, we do have a very strong science background in the curriculum that is reflected in the curriculum itself. Um, that we have basic sciences that are very rigorous, and we use a systems-based approach. And a lot of other medical programs use this type of approach, which means that we look at when you're learning the basic sciences, we look at one whole system altogether. So you may look at the cardiovascular system or the musculoskeletal system altogether. Um, we do have a strong foundation in naturopathic clinical theory as well. That allows us to analyze patient cases and analyze the evidence to come up with that best approach for each individual patient. That's often a mixture of conventional and naturopathic approaches. We use a lot of active and hybrid learning in technology. All of our laboratory courses are face-to-face and hands-on. However, there's a lot of flexible learning time within courses that are more lecture-based. You may have a course, for instance, that meets every other week, and then one week you're doing more hybrid or remote activities. This allows us to kind of cater to different learning styles. It allows some flexibility for students in being able to manage their time effectively. And it works well for facilitating what we want, which is deep long-term learning. Not just memorizing for a quick test that you're going to take the next week, but one thing that's very important in all types of medicine is that you understand these fundamental concepts before you move on to the next level, because you will need to know everything as far as how the body works and functions. So it is important that you learn for long-term retention, and we really try to facilitate that as much as possible with the learning techniques that instructors use. At the Seattle campus, there's a longer history of naturopathic medicine. Um, in San Diego, you'll find there's a lot of integrative medicine and a growing ND community. We also offer our students the opportunity to transfer between campuses. So a lot of students take advantage of this if, for instance, they may have a shifting family or responsibilities, or maybe they decide that they want to be in a particular area that is not where they went to school to be able to graduate in that area because they're planning to practice in Washington or California. So we allow students to transfer between campuses because the curriculums are essentially identical. There is a little bit of a different flavor per campus, but we teach the same courses on both campuses, so that's why you can transfer easily. So one of the other things that makes our program unique is the early entrance of clinical training. So the first year, not the first quarter, but starting in the winter or the spring of your first quarter, you start with observation in our academic clinic, so in our student clinic. Um, you will, during your clinical training, move up in responsibility as time goes on. So you start out with observation, then it becomes a little more active, and then eventually in your last year, you're primarily in the clinic. You have some classes, but you're spending at least 4 rotations a week in the clinics, and that can include our training clinics on site, which are on our campuses, as or we have some external sites too, where you can do some of your clinical hours. Um, we also have some specialty shifts such as IV therapy that you can do some as part of your clinical hours. You also can earn dual credentials. That's one thing that is unique about our university compared to some other programs. And these are the options that are available right now. Dual degree in acupuncture and East Asian medicine in Washington, counseling and health psychology on both campuses, uh, and a certificate in functional medicine, which is available in both campuses. As well, there are curriculum concentrations that are available to students at the Washington campus in pediatrics or community health. So program outcomes, this is what we expect you will have by the time you graduate. And these program outcomes guide your learning throughout the curriculum. Um, each course holds a little piece of this, sometimes more than one piece, but each of those little pieces add up to this overall view of what you will be able to do when you graduate from our program in naturopathic medicine. So these areas here, these are the program outcomes. This is what you can expect that you will gain, the knowledge and skills that you will gain during the program.
Actually, before we go into admissions, I saw there's at least one question that might be worth talking about while we're in the program content,
Yeah.
Dean Connor. So this student asked, do NDs administer IVs or do they oversee IV therapy processes for the patient?
So it can be either one. We do train students to be able to administer IVs themselves. The way that some people do that in practice, sometimes they're overseeing another practitioner. Depending on the state, you have the capability to designate certain duties to other practitioners, like a medical assistant or a nurse. Um, so not everyone does that necessarily in practice, but you are trained to be able to both administer as well as just prescribe and oversee that.
Great. And I know there's one other question that Terrence was kind enough to share the ANMC resources on, but it might be good for the entire group for you to answer. What do MD program scopes include that ND programs generally do not?
Yeah, that's a good question. So the main thing that we do not do as NDs as a whole is hospital-based care, and a large focus on higher force intervention. So there aren't ND surgeons per se, although some NDs can do minor office procedures and minor surgery within their offices. So that's really the big difference. We train primarily and we prepare students primarily to be in outpatient settings. Now, that said, there are some NDs who occasionally do work in more hospital-based settings or uh, inpatient settings, but that's much less common. And then the other big thing I'll mention too is that we have a few specialties, but specialties are very different than they are in like for MDs or DOs. Um, So we trained most students to really be generalists. Some of them do go on and do some specialty work. They may have a particular population or condition that they work with, or a modality that they specialize in, but that usually comes much later. We really think it's important for students to have a broad foundation, and then specialty can sometimes occur after you graduate. And there are a few recognized specialties in the naturopathic profession, but there's not all of the ones that are available in conventional medicine. Um, so that is one major difference, I would say, as well.
Great. And we have a couple other questions that are relevant to things that you've talked about. And then Kaylee has a great question that I want to hold till the end that I think will be a broader discussion for you. But um, one, you mentioned physical medicine and manual manipulations. Is that referring to adjustments and acupuncture, or are there other things that you're referencing with that comment?
Yeah, so that is, and specifically when we're talking about California, California, we're prohibited from doing the high force grade manipulations. Um, Acupuncture is variable, how that is incorporated into state laws. For instance, you can do acupuncture with your ND license in Arizona and a few other areas, but the majority of states where we're licensed, we cannot do acupuncture. And we're not really trained to do acupuncture, to be honest, unless you do a dual degree. Myself, for instance, I did a degree in acupuncture. I have a master's in Oriental medicine as well. But we do not include acupuncture training within our program.
Okay. And this student asked about, most students are going to be in a 4-year track without planning on a dual degree, but is that student able to switch to a 5-year track at any point?
Yes, so you can. There are certain points when that makes more sense than others. So the big divider is really after your second year, if you're on a 4-year program. So the way that our kind of typical 5-year programs are is you do the first 2 years in 3 years, or you do the last 2 years in 3 years, and that's what makes it the 5-year program. You can sometimes switch at other times, but we really try to discourage that because all of our courses are sequenced and kind of designed to go together. So when you get off a track, it can sometimes be a challenge to make sure that you're getting all the content that you need and that you're kind of getting the courses in a sequence that makes sense. So there are some times when there's better times to do that, but it is potentially possible at other times too.
And related to that, there was a question on finishing in an accelerated fashion before 4 years. Is that at all possible?
Right now, we do not have the opportunity to do that, and again, it's because our courses are sequenced, and so you're taking classes really through the entire last year, even though there's not as many in the last year. Um, so yeah, so right now we don't offer an accelerated program.
Okay, and then last question here, and then we'll jump into admissions and financial aid. But if a student were interested in a pediatric specialty within the ND and wants to start in San Diego, when does that student need to consider switching, it sounds like, to Kenmore for that specialty?
Yeah, good question. The two curriculum concentrations start in the third or fourth year of the program, and so if you were interested in doing that, you could complete your first 2 years in San Diego and then transfer to Kenmore.
And there was a question about the dual option with acupuncture currently only offered in Kenmore, but that may change in the future, correct?
That is correct. Yes, we are looking at that right now.
Okay. Great. So I'm going to pause on, there's a few other questions that I think we'll talk about as we get into the end in the Q&A. But let's talk through admissions a little bit now. I know some of you are interested in a few years in the future. Others of you are interested in this coming fall. So it's a good opportunity for us to talk about both and how you can plan for that. Generally, our students coming in have to have a cumulative GPA of a 3.0 or higher and complete the program prerequisites, which I'll share in a second on the next slide. We really look at kind of a holistic view of your entire application file. So we're looking at your academic performance, but also your maturity, your demonstrated humanity and qualities, things related to work and volunteer experience, things that really show that you're a strong fit for the field and for naturopathic medicine in general. It's not purely an academic game. It's not a gatekeeping exercise. I talk to a lot of students in my work where students are concerned, well, you guys are denying me because of my grades or because of such and such. The reality is we don't want to recruit you into a program that you ultimately have to take on debt, or at least it's a high expense for you in one way, shape, or another, and then struggle moving through a quarter or a year of the program, and then you end up leaving the program because you struggle for any number of reasons. So we try to really have a good opportunity to assess your candidacy at the front end so that we save everybody a lot of headache later on. We certainly don't want you to walk away from best year halfway done with your program with a lot of debt and you're unable to complete. So we really want to try to get a good sense of your fit for the program, your ability to be successful. And so it's not that gatekeeping exercise of who's good enough or not. It's merely just, can we make sure that you're going to successfully complete the courses that are necessary for your license and to be able to practice. So it's really looking out for your best interest when we go through this process. If you're applying for this coming fall, so fall of 2025, so we're a year out from the next start, November 1st is our early application deadline. The beauty of going in on those early application deadlines, one is you have a decision a bit sooner, which is nice, but you also can guarantee the best opportunity, at least to be considered for financial aid, for institutional financial aid. And I'll get into financial aid in a second, but when you're talking about scholarships or anything provided by the university, that money is not infinite. So that money gets determined earlier on in the application cycle. So the earlier you apply, the better, so that you have opportunities for those things. We also have a priority deadline in February. And again, similarly, have the same types of benefits. Generally, the scholarships are not drying up by the priority deadline, but certainly the sooner you apply, the better. And then for students beyond that February 1st priority deadline, we'll review on a rolling basis. But my caution to you after that, when you get into a rolling basis, if we hit capacity, let's say in May or June, anybody who applies after that date can't come merely because we've hit capacity. So you want to apply as soon as you think that best year is somewhere you want to be considered and you want to really demonstrate your interest. I also like the flag that sends to the faculty and the deans when you apply sooner. I've worked with students in admissions for nearly 18 years, and when students apply on the deadline or like at the final hour, especially in a rolling program, faculty don't necessarily see that as a signal that you're really interested in the program. Usually students that are really on their game and really belong there and a good fit, they apply and meet deadlines, and they do that earlier on in the cycle. That also allows you to plan more effectively. We can help give you more guidance. Our enrollment team is great at kind of giving you the nuts and bolts of everything you'll need to prepare for school, especially if you've been out for a little while or if you have to prepare for finances, get your books, you have to move, whatever those things are involved. Give us the best opportunity for success for you. And time is always a benefit in that equation. So certainly apply as soon as you can. Now, unfortunately, with the nature of these science-based and medical programs is that you have a lot of prerequisites. And again, this is to determine, make sure that you're going to be successful in the coursework that you're going to take on. I hardly took a biology course after high school, so I know I wouldn't do very well in the first quarter, let alone in the program here. So we want to make sure that we have students that are adequately prepared. So this list, and we have some more exhaustive descriptions on what qualifies and what doesn't. So please lean on your enrollment advisors. You'll be hearing from them if you haven't already, and you'll have their contact information. They're on the call here today as well. They can answer questions that you have about these courses, because I know many of you are around the country and some of you are even outside of the US. So talk to us about the courses you have taken or you need to still take, and we're happy to kind of give you a general direction on that. We'll prepare a formal transcript evaluation and a prerequisite plan for you once you apply. So prior to application, we can look at your transcript. If you want to send us an unofficial transcript and say, hey, I took that physics course, will that count? We can look into that. That's no problem. But for a formal evaluation and your course listing and the prerequisites you'll need, we'll do that once you submit an application. So we can work with you on that. And though there were some questions about applications, though we generally open the application in the fall for the subsequent year, there may be opportunities in the coming year where we'll open the application a little wider so that you can apply for a future term. Let's say you're not ready for 25 right now, but you want to apply for 26 and then work with us on a prerequisite plan now so that you can spend the next year doing your prerequisites, that's fine. We're going to be working on that for you. So while we're currently set up just to have the 25 application open, we're going to be working on a more open application process so that we can help you assess all of these pieces. So quickly, everything on the left column there you see is a required prerequisite. So you have 2 chemistry courses. They have to be with labs, similarly 2 biology courses with labs, and they must cover cellular biology and genetics. 2 organic chem courses or a biochem for that second chemistry class. A physics course that's not required with a lab. It just has to be algebra or calculus based. Intro to psychology or developmental psychology, and then college level algebra. Most of you, if you're in a science-based program in your undergraduate studies or completed a bachelor's in a science area, you're probably covered most, if not all of these, but we can certainly help you kind of discern what you might need. We also have some recommended courses you see in the upper right-hand corner, biochemistry, anatomy, and physiology, and microbiology, that those would really be helpful for you to be successful in the program. And then we suggest that those courses in the lower right corner that you've had exposure to. And while it's not a requirement, they'll just help you with being further successful in the program. Dean Connor, is there anything you'd like to add on these prerequisites that might be helpful for students?
Yeah, I'll just underline that, the prerequisites are really there to help you and to help us understand that you're ready for the program. But it's really to help you because you do need all this requisite knowledge to be able to succeed in the program. And we have found over the years, this list has been honed over the years because we found that, when we change some of these prerequisites or lessen them, change them at all, that students didn't do as well in the program. And that is really the ultimate goal, is to make sure that you're prepared, you can be successful in the program. So that's why we do have kind of strong recommendations in this area.
And it's important to remember too that so we are an accredited program, and accreditation typically has requirements around whether it be academic quality, the types of faculty you have, the courses that are required. All of these things ensure a quality education, particularly in something as significant and serious as naturopathic medicine, and making sure that you are meeting the requirements for your future licensure. So a lot of this stuff is informed by making sure that we're meeting standards or exceeding standards necessary for your license. So it's all in an eye for, as Dean Connor mentioned, to making sure that you're successful and you have the outcomes that you want from the program. Because we know it's an investment of time and money for sure. So we want to make sure that you get the best out of it and ultimately get licensed and do the things you want to do. So for applying, it's pretty straightforward. It's right on our website. You can go to the admissions page, or you can go directly to apply.bastyr.edu. Fortunately, you don't have to take any standardized tests. You don't have to submit references. We're just looking for your transcripts. Make sure you request all of them. This includes your undergraduate. If you've taken any graduate courses, send those to us as well. Courses that you took in the summer somewhere that were maybe supplementary to your undergraduate education. In some cases, students kind of piecemealed and got 4, 5, 6 different schools before they got their bachelor's degrees. We do need to see all of those transcripts. In the application process, we can evaluate your application with unofficial transcripts. So if you can just send copies to us at that time, that's okay. We do need to see that you've either earned your bachelor's degree or you're in progress to earning your bachelor's degree. So if you're currently enrolled as a senior, obviously you wouldn't have your degree yet. But if you're admitted and you ultimately choose to enroll at Bastyr, where you'll make a deposit and commit to us, you're going to have to submit all of your final official transcripts at that time if you haven't already. So that allows you that time that if you're currently in school, you can apply now. There's no reason to wait until that you've walked in May or whenever you graduate. We want you to apply early and get the same benefits of those early applicants, and don't be penalized for that because you don't have a final diploma yet. But you will need to have that before you start your courses. Similarly, your prerequisites have to be completed as well. So talk to our enrollment staff and really determine what you need to take and plan to this, and let us know when you're going to be taking those things. And then our staff will be checking in regularly to make sure that you've completed all of those, so that when you get to the start of classes in September, you're not going, oh, I missed that one class. We don't want to hold you up. So make sure you get your prerequisites done. As a thank you for coming tonight, we're going, or today, I'm in East Coast time, so forgive me, I'm later in the day than y'all. But use that code at the bottom, Future Best Year in, and you might want to write it down because it might be hard to spell when you're trying to remember it later. What was that code that they had? So write that down. It's Future Best Year in, so it's just best year with IAN at the end, and that will waive your application fee. So we want to thank you that you're obviously taking time out of your busy schedule to join us and hear about the program and what Best Year has to offer. So we just want to thank you for that and acknowledge that with a fee waiver code. So please use that as you're applying. And if you forget it, the enrollment staff will be happy to share it with you later on. So once you apply and you have all of your transcripts in, or at least your unofficial transcripts again are okay, the admissions committee will review your file, and the admissions committee includes both enrollment staff and our faculty. And then applicants that have met all of the basic requirements will be invited to interview, and that interview is conducted by the faculty. And Dean Connor, I wonder if you'd be willing to just share a few details about what that process looks like in the interview process for students.
Yeah, so we may be making some slight changes to this year, but what we look for in the interview is always attached to our is based on what our admissions criteria is. So that means that we're looking for evidence that you have the intellectual kind of cognitive ability to be successful in the program. We also look at areas such as your knowledge about naturopathic medicine, if you have an experience in naturopathic medicine, um, ethical questions, kind of similar to what you would expect for entry into other medical programs. So we ask those particular areas for our related to our admissions criteria to make sure that you fulfill all those areas.
Great. And then the faculty reach out to us and usually with great news, and we're excited for you and able to relay that to you. So you'll hear from the enrollment staff. And we'll also encourage you that you don't have to, while it says apply for financial aid here as kind of a once you're admitted step, you can do that at any point. The only thing to remember is, and this is for domestic U.S. citizens. So for international students, this is different. You wouldn't be applying for, this is federal financial aid. This is basically student loans that the federal government provides for US-based students. If you're applying for aid, you can apply at any point, but you won't receive any aid package until you've been admitted. So if you want to make sure you're on top of things, and let's say you get all your materials in and you're waiting for a decision from Best Year for admissions, you can be filling out your financial aid, your FAFSA, and have that sent into the government and have that processed. And then it'll be sent to our financial aid office, and they just wait with it until they have your admission decision. Once they have that, then they'll be able to issue you your package, and you'll know exactly what kinds of aid that you'll be qualified for. So you don't have to wait until you're admitted if you don't want to, particularly if you're applying later in the cycle. I always encourage students to apply for your financial aid as soon as possible, just so that's happening concurrently. And some of you may be familiar, there's been some hiccups with the FAFSA process this past year in particular. We're hoping that that'll be smoothed out for next year, but allowing for some extra time for that to happen is a good thing, just in case there's any issues. We'll also ask you for you to pay an enrollment commitment deposit, and we're probably going to have an enrollment commitment form at the time. So that information will be sent to you, so you don't have to worry about that. And we'll help you with setting up your Best Year email accounts and the things that you need to access your courses. And just a reminder, as we just talked about, make sure you submit all of your final transcripts that we discussed. So for financial aid, it's obviously you're making a big commitment of time and finances in particular for a 4 or even 5-year program. And unfortunately, that's the nature of the beast, most programs that you look at. So most students, with some exception, will be applying for some sort of federal student loans. And there are plenty of loan programs out there in general, but I always encourage students to start, at least American students, start with the federal financial aid, because these loans are low interest, long-term repayment plans. They have options for loan forgiveness if you go into nonprofit or government work. So there's a lot of flexibility that the federal loans provide that private loans from a bank or credit union just don't provide as much for you. So make sure you do your research on that. But the financial aid at the federal level is generally your best, at least first option, if not the primary option that you'll use to fund your studies if you need to take loans. So you'll need to submit the free application for federal student aid, otherwise known as FAFSA, and there's federal guidelines for that. The form has been simplified, and I'll talk about the different types of loans in a second that you qualify for. There's also an internal financial aid form that Bastyr has as well. So in addition to the FAFSA, you'll complete that form that we have. It's pretty basic information. Your enrollment advisor can share that with you. You want to submit those quickly. Again, early on in the pipeline is better so that we can get that all situated. It's really hard when you get to the start of class and financial aid hasn't been dispersed yet, and it just gets kind of complicated. So I always encourage students to do that quickly so that that's all planned and settled before you get started with your classes. In some cases, you may be asked for additional documentation. Could be related to employment or other financials. And so if you allow time and you apply sooner, you'll have the ability to do that without delaying your start to your program. So one unfortunate truth for students at the graduate level is that there's no need-based aid. So regardless if you're independent or if you're in certain financial circumstances that would warrant a need-based aid like you might have at the undergraduate level, if you've ever had a Pell Grant or other similar need-based aid, that's not available to graduate students. Similarly, that means that there's no subsidized loans either. That's another topic you may be familiar with in your undergraduate financial aid, where interest is kind of deferred while you're in school. Unfortunately, with graduate loans, at least with the federal government loans, they all accrue interest from the day you take them. So while you're in school, you'll be accruing interest on the principal of your loan. So sometimes students, if you have the ability, especially if you're working or if you have some savings, if you can pay off that interest while you're in school, that's a good thing because then you're not accruing interest on top of interest for the 4 or 5 years you're with us. But it's certainly up to your personal circumstances. So the first loan that you'll qualify for, and this is not credit dependent, it's the federal direct unsubsidized loan. You may have heard the Stafford loan talked about in the past. That's an older term, but it's essentially the same loan. And you'll qualify for $20,500 per academic year. That current interest rate, which is subject to move, and actually the Fed's signaling they're going to be dropping interest rates. That's a good thing for your loans coming in the next year for 25, 26. But current interest rate is just over 7%. There's an origination fee that's very small. There is a lifetime borrowing limit. So if you've taken a lot of these unsubsidized loans in your undergraduate study, actually, I think they might have that cap at the graduate, so you can forget that, forget that part. But I think at 138 is your cap at the graduate level. But there is a lifetime borrowing limit to make sure you don't hit that cap. It's basically to protect you from over borrowing. And I'll talk to you about kind of the uses of these loans in a second. Now, I'll try not to overcomplicate it for you, but let's say you've got $20,500 in that unsubsidized loan, the direct loan that we just talked about. But let's say your tuition, I'm just making up a number. Let's say your tuition is $40,000. That means that you're only covering roughly half of that 40,000 with that first loan. But what you can do then is borrow in the Graduate Plus loan program. And similarly, this is pretty low interest, although it's always 1 percentage point higher than that direct loan we talked about. So it's a little bit more expensive to borrow, but it's still relatively cheap in overall loan borrowing. And you have long-term repayment. There's no lifetime borrowing limit on this, and this has been under scrutiny with the government, so we could see how that moves over time. But this one allows students to borrow up to the cost of attendance. And this allows you basically, if you had that 40,000 in the example I was just sharing, if you needed about 20,000 to cover the balance of your tuition, but then you say, well, wait a second, I'm relocating to San Diego or Kenmore. I need money for my apartment and I need money for food and other expenses because I can't work. I'm busy with my classes. I want to focus on school. You might say, I need $15,000 for living expenses for the year. And there's a number that financial aid works on as a cap for you. But that allows you to borrow in the plus loan up to that total cost of attendance that factors in lifestyle expenses. So you'll have that ability to do that. You don't have to panic and go, I don't know if I can't relocate across the country because I can't afford to do that. You do have the ability to take loans to cover those expenses if you chose to do that. We're obviously not encouraging you to overborrow, but that's an option. And so your aid is most commonly used for not only tuition, but your books and supplies, housing expenses, transportation, particularly if you're taking public transportation or something like down in San Diego, or if you have a car, supporting your technology expenses if you have a computer. Some students will, if they need to, will use it for childcare or boarding, other things that might be related. Basically, the definition is anything that's related to you having to study. So not for some miscellaneous expense that you chose to go to a sporting event or something. You're using this for living expenses that are related to your studies. So it's really designed to have a cap to protect you, but give you the money that you need to be successful while you're in school and not eating ramen and hoping to get you through the program on a shoestring. It's not intended for credit cards, medical equipment, travel expenses, those types of things. The government's not chasing you. We're not going to line item everything you spent your money on, because basically the money gets dispersed to your account, and anything that's over your tuition, you get a refund. But you're expected to be using this for related expenses while you're in school. And then these loan repayment options, I won't go too in the weeds, but as I mentioned, there's some flexibility here based on how much you're making after you graduate, your personal circumstances. You might decide to, if you get an entry level type job that's making a certain amount, but you're going to be making more over time, you could get a graduated loan payment so that it starts low and then it gets higher as you make more money. You can also have income-based repayment plans that are directly tied as a percentage to the amount of money that you're making. And you can choose between 10, 20, or even 30-year repayment. We generally discourage 30-year repayment for students because that's an awful long time. But for many students, 10 to 20 and 25 years is fairly common for repayment here. If you have any more specific questions about financial aid, you can direct them to Chris Lawfrey, who's your financial aid advisor, and that's his contact information there. With the staff right now, and everything's very busy with the FAFSA kind of mess that they inherited this year from the government. If you email the finaid@bastyr.edu email, that's probably the best way to reach the staff that you need to. So use that, and then they'll get you to Chris or another member of the team who can help you with anything you need there. And so now we're going to answer any questions that you have, but I want to, at least on the screen and the squares that you can, or circles rather, you can see on the screen, Terrence, Carrie, and Daniel are the 3 admission advisors on our team that support the ND program. So you'll be hearing from each of them. If you have any general questions or you don't know who your advisor is, you can just reach out to admissions@bastyr.edu. Of course, Dean Connor can answer any questions you have about the curriculum or outcomes or any more specific questions about the program. And I know you have some questions in the questions box, so I don't want to hold those up any longer. And the one that was my favorite that I want to make sure that we get to with Dean Connor, it's kind of more of a philosophical question, which I think is important. How do you foresee the global perception of naturopathic doctors evolving in the coming years, and what are your expectations regarding the expansion of their scope of practice?
Yeah, that's a great question. I wish I could predict for sure, but I I can kind of tell you about how it has evolved over the past few years, and that has increased, like, we're going in a positive trajectory as far as acceptance kind of within the medical community and elsewhere, in scope of practice, in employment and practice opportunities that are available to naturopathic doctors. Um, so that's all, really in a positive direction. There have been more states that have been licensed or regulated, for instance, in the past few years. There's been scope expansion in some areas. And there haven't been any states that have rescinded the ability to practice. So that's all in a very positive direction. I think as far as our intersection with conventional medicine, that's probably less predictable. It's certainly not, uh, on an individual level, we've made a lot of strides in that area. I think what you'll find, especially if, depending on how deep you delve in social media and on the internet, is there's still some restrictions, and there still is some uh, complaints or concerns against naturopathic medicine, but I think overall it's a lot less than it used to be. Unfortunately, because of social media and the internet, some people have a big platform to be able to, um, you know, uh, share that type of information, but it really hasn't changed. It's the same areas that people have been skeptical of, for all along. Um, it's just that now that people have kind of a platform to be able to to share some of that. It might look worse than it used to. But for people in the profession, you know, over the past 2.5 decades that I've been in the profession, it is all up. It is all more positive. There is more and more acceptance and growth of naturopathic medicine, particularly in the US and Canada, also to some degree globally, but I'm not as familiar with that. So that's a little bit more difficult for me to say. But, you know, in the US and Canada, which is probably where most of our graduates practice, um, there are a lot more opportunities than there used to be for places that you can practice in, the types of things that you can do, and the number of patients that you can reach.
Realizing I'm on mute here. There was a question about the prerequisites. I know they have to be completed generally within the last 7 years. So there was a question about students that have those prerequisites, but they go beyond the 7 years. Can you speak to how they should consider tackling them, and can they tackle them at best year?
Yeah, so we do offer some of the prerequisites here, and the the intent behind that is that you have recent medical knowledge. It helps you do well within the curriculum. Um, so if it has been more than 7 years for some of the prerequisites, sometimes what we will ask people to do is take a refresher course instead of repeating maybe a basic course, taking a course that's either a refresher or it's a more advanced course in kind of the same series. Um, so we know that you still retain that background knowledge.
Great. Yeah, and definitely reach out to your enrollment advisors, and they can help discern some of that, or connect with Dean Connor and figure out what best solution there is for your individual circumstances. Everybody's a little bit different, so we always want to consider that. And in some cases, some of you are coming with some level of health professions or medical experience, you're nurses or otherwise, and so we take that into account as well. And so if you're a practicing nurse, we may not make you take Bio 101 all over again. So
Right.
um can you speak to the admission, like the acceptance rate at all, Dean Connor? I have a general estimate in my mind, but I'm not sure. I don't want to overspeak if that's incorrect. So,
You know, I'm not sure that we really keep track of that very well. So I think, you know, the most important thing for us is understanding that you have interests, that you can do well in the program and the profession. So a lot of it is, are we both a right fit? You know, we're not interested in really denying people who are qualified. If you're interested, you know, if you meet the qualifications, um, and then we often will offer you a spot. But I think equally it is important that you fully understand, you know, the profession and what, you know, what the curriculum and what the program is going to be like, so that, you know, you don't end up like you were talking about earlier, Marcus, you know, kind of into the program and deciding it's not right for you, or struggling academically. So we really want to make sure it's the right fit for you too.
yeah, and to that end, I always encourage any of you that are on the call, or any students considering the programs, have an honest conversation with your enrollment advisor. And in the cases where they need to, they certainly will include Dean Connor and other faculty. But they'll give you an honest assessment of kind of where you're at. And if you say, I just graduated and I have 1.2 GPA, they'll probably tell you you're going to struggle in the program. So we don't want to encourage you to apply and only to have bad news at the other side. So our team is good at kind of advising students that are appropriately the right fit and have a likelihood of being successful in the program and potentially admitted to move forward. So we try to avoid getting students deep in that process that aren't going to get admitted, because I know we hate delivering bad news. Most of us would much rather call you excited and say you've been admitted. So that's a deliberate part of our process. I think that really speaks to the mission and care that Best Year is known for. So make sure you have those honest conversations with your advisors early on in the process beforehand. There was a financial aid question I want to make sure that we reiterated on. So do you accrue interest on these on student loans while you're a student or after you graduate? So because they are unsubsidized, which means that the government's not providing any support to offset those costs, you do accrue interest from the date you take the loan, not from after graduation. So the only I'm trying to think of the word for it, but there's a brief window of time, about 6 months after you graduate, that you don't have to pay on your loans, that they give you kind of that grace period. But the interest is still accruing from the time that your loan was issued. So if you issued it in your first year, you're going to accrue interest all 4 years while you're in school and during your grace period. So that's why I encourage students, if you can, chink away at the interest over time so that's not accruing extra interest while you can. There was a question about scholarships. So we do have an honors scholarship program, and we can share that link with you all in the chat. It's probably the best way to do that. So I will do that. Hopefully you all have access to that. And you can check for further details. Those are awarded at the time of admission, and they're on the basis of largely academic performance, and in some cases fit and other experiences that you have, and they vary. So it's tough for me to say it explicitly, like you'll qualify for this amount of money, but those scholarships are available for the first year. And I believe, Carrie or Terrence, correct me if I'm wrong, they're renewable for 1 year. Is that correct? So basically 2 years.
For the Bastyr University Merit Scholarship?
Yeah, the honor scholarship. Yeah.
Yeah, it's just 1 year.
Oh, it's 1 year. I think. Okay.
Mhm.
Thank you.
Yeah.
Glad I asked y'all. There's a question. Okay, so let me make sure I get this right. Do you have a way of deciding that some courses taken? That's a good question. Yeah. So for students that went to, and I used to run into this in admissions a lot, students that went to, let's say, Harvard, I'm going to pick a bunch of random ones, but Harvard versus like a lower end school, public, whatever, is there consideration, Dean Connor, in the admission process for a student that clearly, like if they got a C at Harvard, that's probably a little different than a C at a, lower tier school.
Yeah, I would say to a certain degree. I mean, we do take that into account, especially if someone is very close in their GPA. And the other thing I would say is not only the university attended, but what was your major? So if someone was a major in, microbiology or something that's maybe a biochemistry, something that will probably help them in the program, and they had duplicate courses, so maybe they didn't do well in that one course, but they have other courses where they did do really well that are kind of similar. We do take that into account. So but as close as we do, like students to get as close as possible to that 3.0 for the prerequisites and for their overall GPA, because that really has been shown that they will do better in the program. So
Well, this is probably a good opportunity to note too that sometimes we have non-traditional students that consider this. I mean, I think we have a tendency to kind of focus on a 24-year-old that's relatively right out of school, and your grades are much more relevant. Whereas somebody who's maybe in their 40s, they've been working for 20 years, maybe even working in a similar profession. They've gone and gotten a nursing license, whatever. But their grades maybe were a 2.7 in their undergrad, but that was 20 years ago. The relevancy of those grades is maybe a little different after you've been working for some time, have maybe some really good relevant work experience. So those are things that the admission committee will take into account, that it's not merely going to be a numbers game. And so in short, I don't want you to feel discouraged if you feel like on paper you don't hit that exact 3.0, especially if you have a lot of work experience or other things that you feel rounds out your academic studies. So again, making sure that you're going to be successful in the program. If you just graduated and you're well below that, that's a different story. But somebody who has a lot of experience, we consider that as part of a holistic review of your file. So I know we went a few minutes over. It looks like we've answered most, if not all, of the questions. There were a lot of great questions. So thank you all for your questions and for your attention here today. I hope this was helpful information. We're excited that you're considering Bastyr. We hope that you'll apply. If you're applying for future years, so looking at 26, 27, I know there's a few younger students that are kind of mid-program right now. We still encourage you to reach out to your enrollment advisors, learn a little bit about the program, ask the questions you have. If you want to make sure that you're aligning, it's a good time to talk to your undergraduate advisor too. If you're saying, hey, I'm thinking of Bastyr's ND program, I got to do these 8 courses. how can I make sure that I get them in my junior or senior year while you're at UW or somewhere else that's a relevant program? So talk to our enrollment advisors, talk to your faculty, and know the only dumb questions are the ones that aren't asked. So make sure you talk with us, and we're happy to advise you and give you the best way forward. But thank you again for your time. Thank you, Dean Connor, for all of your information today, and for our enrollment staff for joining us. And we look forward to connecting with you all soon. So thanks so much.